Hemorrhoids, also known as piles, are swollen and inflamed veins located in the lower part of the rectum and anus. They can cause discomfort, itching, and bleeding. Hemorrhoids can be either internal inside the rectum or external under the skin around the anus. Types of hemorrhoids: internal hemorrhoids. Location: found inside the rectum, above the dentate line, a line that separates the upper two-thirds of the anal canal from the lower third. Symptoms: often painless, but can cause rectal bleeding, especially when passing stools. They may protrude through the anus prolapsed in more severe cases. External hemorrhoids. Location: found under the skin around the anus, below the dentate line. Symptoms: can be painful, itchy, and sensitive. They may cause swelling and discomfort, and can sometimes bleed, especially during bowel movements. Causes and risk factors: hemorrhoids are caused by increased pressure on the veins in the rectal and anal areas. Contributing factors include straining during bowel movements. Chronic constipation or diarrhea can lead to straining, which puts pressure on the veins. Pregnancy. The growing uterus can exert pressure on the veins in the pelvic area, leading to hemorrhoids. Obesity. Excess weight can increase pressure on the pelvic veins. Sedentary lifestyle. Prolonged sitting, especially on the toilet, can contribute to the development of hemorrhoids. Age. The risk of hemorrhoids increases with age as the tissues supporting the veins weaken. Heavy lifting. Regular lifting of heavy objects can put strain on the veins in the rectal area. Chronic conditions. Conditions like chronic liver disease or inflammatory bowel disease can increase the risk of hemorrhoids. Symptoms. The symptoms of hemorrhoids can vary depending on their type. Internal hemorrhoids. Rectal bleeding, bright red blood on toilet paper or in the stool. Prolapse. The hemorrhoid may protrude through the anus during bowel movements. External hemorrhoids. Pain and discomfort. Painful swelling or lump around the anus. Itching. Persistent itching in the anal area. Bleeding. Bright red blood on toilet paper or in the stool. Swelling. Tender, swollen area around the anus. Diagnosis. Hemorrhoids are typically diagnosed based on medical history and physical examination. Healthcare provider will review symptoms and perform a physical examination, including an external inspection of the anal area. Digital rectal exam. Healthcare provider inserts a gloved, lubricated finger into the rectum to check for internal hemorrhoids or other abnormalities. Proctoscopy or anoscopy. These are procedures where a small, lighted tube is inserted into the rectum to visualize internal hemorrhoids and assess their severity. Sigmoidoscopy or colonoscopy. In some cases, these procedures may be used to examine the lower part of the colon and rectum to rule out other conditions. Treatment. Treatment for hemorrhoids aims to relieve symptoms and address underlying causes. Home remedies and lifestyle changes. High fiber diet. Eat foods high in fiber, e.g., fruits, vegetables, whole grains to soften stools and reduce straining. Hydration. Drink plenty of water to prevent constipation. Over-the-counter treatments. Topical ointments and creams help reduce pain and itching. Suppositories can relieve symptoms and reduce inflammation. Warm sitz baths. Soaking the anal area in warm water several times a day can provide relief. Avoid straining. Avoid prolonged sitting and straining during bowel movements. Medical procedures. Rubber band ligation. The small band is placed around the base of the hemorrhoid to cut off its blood supply, causing it to shrink. Sclerotherapy. An injection of a chemical solution into the hemorrhoid causes it to shrink. Infrared coagulation (IRC). Uses infrared light to burn and shrink the hemorrhoid tissue. Hemorrhoidectomy. Surgical removal of large or severe hemorrhoids. Stapled hemorrhoidopathy. A procedure that involves stapling the hemorrhoids to reposition them and cut off their blood supply. Prevention to prevent hemorrhoids or reduce the risk of recurrence. Maintain a healthy diet. Eat a high-fiber diet to keep stool soft and regular. Stay hydrated. Drink plenty of fluids to prevent constipation. Exercise regularly. Regular physical activity helps prevent constipation and reduces pressure on the veins. Avoid prolonged sitting. Take breaks and avoid sitting for long periods. Practice good hygiene. Keep the anal area clean and avoid using irritating or harsh soaps. Conclusion: hemorrhoids are a common condition that can cause discomfort and inconvenience. They can be managed effectively with lifestyle changes, over-the-counter treatments, and medical procedures if necessary. Maintaining a healthy diet, staying hydrated, and avoiding prolonged sitting can help prevent hemorrhoids and reduce the risk of recurrence. If symptoms persist or are severe, seeking medical advice is important for appropriate diagnosis and treatment.